Hey, this is Dr. Tom Rogers at Performance Medicine. Um, I'm kind of casual today because, hey, it's Memorial Day. I'm on vacation. Um, and also, I love tennis. I'm coming to you today from Knoxville, from our office here in West Knoxville. And today we're going to talk about an important topic, an important vital sign, your heart rate. How important is it to you? And I want to talk about another thing that I've been seeing a lot of lately, and that's atrial fibrillation, which is an irregular heart rate that we're seeing more and more of these days for some reason. It's a lot more common nowadays than it was a couple decades ago. And I'm seeing it a lot in my age group, especially former athletes, maybe more, I see it more in former endurance athletes for some reason. It's kind of well known when you speak to cardiologists about it, but it's a pretty common condition, and you need to know if you have atrial fibrillation for sure, because it increases your risk of death, a lot of other complications like stroke, and blood clots. But anyway, let's talk about heart rate in general. You know, when you go into a doctor's office, you should, besides your blood pressure, which is very important, the lower the better generally, your heart rate should also be measured, and it's something that you should keep track of at home. I certainly do with my Aura ring. You know, the new Apple Watches are great because they monitor your heart rate and also your rhythm. And some of them even do measure your heart rate variability, which we'll talk about, which is a very, very important measurement of how healthy you are. But anyway, what's a normal heart rate? Usually in adults, it's usually between 60 and 100 beats per minute. In kids, 70 to 100. In general, the lower your heart rate, the better. That's why athletes or really fit people have heart rates that are lower, sometimes in the 40s. But it's good to keep a track of your heart rate, and you need some kind of measuring device to do it, because you don't want to just take it one time when you're in the doctor's office. You want to see what it is when you're sleeping, you know, when you're active. Maximum heart rate, how high you can get your heart rate when you're at extreme exercise, is usually 220 minus your age. For example, for 40-year-old, should have a maximum heart rate of about 180, and as you get older it gets less. I know my maximum heart rate as I get older becomes down. My resting heart rate is still really low, which is a good thing. I wish my heart rate variability was a little higher. It turns out that the heart rate variability is that difference, that subtle, just millisecond difference between that R to R interval between each heartbeat should be variable at rest. So the higher your heart rate variability when you're resting or sleeping, the Oura Ring measures that. And I think the new Apple Watch does too. I know the Sleep Number beds do. But the higher that is during rest, the more healthy your heart is. And it should be lower when you're exercising. So it's kind of weird, but it's true. So it's kind of a good measurement to monitor, and the more fit you become, the better that those parameters will get. You know, of course, your heart rate is the amount of blood pump per minute. The more efficient your heart is means it can pump slower and pump out more in one stroke. So that turns out to be the best thing for you. I guess all of us have a certain amount of heartbeats in our life, so save them up. But that heart rhythm is pretty important too. You know, a lot of people have palpitations that can be caused by a lot of different things. So if your heart rate tends to be on the high side, causes of that could be dehydration, stress, poor sleep. It could indicate poor fitness level. Sometimes even an oncoming infection or illness can signal a high heart rate. As a matter of fact, during the COVID crisis, they studied it and found that even before people got temperature, fever with it, their heart rates were the first thing to go up. So kind of monitor your heart rate. That's a very important measurement of your health in general. In general, the lower the better. The other things, if you have a high heart rate, you might want to check your thyroid, your adrenals, cortisol levels, how you sleep. You may be taking in too much caffeine. You may be eating a poor diet, but the heart rate's a very important, easy to measure vital sign that you need to monitor. Let's talk a little bit about arrhythmias or irregular heart rates. Now, everybody throws a PVC. That's a premature ventricular contraction every once in a while. A hard beat. And what it is, it's a skip beat. So it pauses. So the next beat you get, you have more blood in your heart chamber. So the next is going to feel really hard. You can feel it. When you have a lot of those, usually a PVC is kind of a normal thing. It's not real upsetting. If you have bigeminy, which means every other beat's a PVC, then you need to get that checked out. But if you have a lot of these, you need to get that checked out. And, we do EKGs and certain measurements of those different intervals, which can be kind of important because there are some weird type of fast heart rates like Wolff-Parkinson-White, LGL syndrome, that PR interval, and we measure your QT interval and such things. You don't want a prolonged QT interval if you look at that QRS interval on an EKG. Otherwise, it's hard to know what you have. But those are rare things that if you have persistent problems, certainly if you're fainting with or passing out with a high heart rate, you need to get that checked out for sure. But PVCs are pretty common, not really too worrisome. Atrial fibrillation, which I'm going to talk about a little bit, is where the upper chamber of the heart kind of quivers instead of gets that normal beat. So there's an incoordination between the top part of your heart and the bottom part of your heart. The top part stores your blood, moves into the bottom part, it is ejected and to your body to provide oxygen to all your muscles and tissues. So the top part of your heart, if it quivers, that means you're in atrial fibrillation. And it's easily detectable. I can detect just by feeling your pulse, and you can too. It's an irregular heart rate. So it's not regular. It skips around a lot, and no one is the same. So, and that's a signal. That could be a very dangerous heart rate because it can cause strokes. If that blood's quivering in the top part of your heart, it can form a blood clot there, shoot off, become a stroke. You do not want to have a stroke. It also increases your risk of heart attacks, and it leads to very poor heart function. You may just be tired or short of breath. And I've had several people come in to me with these new Apple Watches and say, hey, this crazy thing says I'm in atrial fibrillation. I'll feel their pulse, listen to heart. You are in atrial fibrillation. We need to look at this because you need to reestablish that normal heart rate, normal heart rhythm. You do not want to let this go unchecked because your chances of a stroke are a lot higher. As a matter of fact, I think there's about 160,000 deaths per year in the United States from atrial fibrillation, 500,000 hospitalizations, and you're about 3.5 times more likely to die than if you're in a normal sinus rhythm. So it's definitely something that needs to be checked out. You definitely need to be on a blood thinner if you have this, and you need to see a cardiologist to do more extensive testing because sometimes nowadays they can ablate it, go in there and through a cardiac catheterization procedure through the electrophysiology lab. Special cardiac doctors do this, and they can actually just kind of burn those different circuits out and reestablish the rate, depending on what they find. But so it is something they're doing a lot more work with this now with cardiac ablations. But certainly, if you have shortness of breath with it, your heart won't slow down, or you're syncopal or you're fainting, you need to go to the emergency room with this, where they can cardiovert you or reestablish that rhythm. And if they can't, then some other things can be done, like an ablation. Certain medications can control this, but definitely you need to get on a blood thinner to thin your blood, so you'll be a lot less likely to have a stroke with this. So it's very important. Atrial fibrillation becoming more common in these days. Why? Who knows? People are less fit than they used to be. They're more obese. They don't take their fitness levels very seriously. Stress certainly comes into play here. I'm convinced about it. I think stress and a poor diet probably cause more health problems than anything that I see out there. So monitor your heart rate. Get you a Whoop band or an Oura Ring or one of the newer Apple Watches if you want to really track it. There's a lot of devices for this. I know a lot of times when I bike, I'll put a chest band on and it measures my heart rate at extreme exercise to see how high I can get my heart rate, what kind of rhythm, etc. And then one measure of your fitness is how fast that your maximum heart rate comes down to your resting heart rate. I mean, if you're exercising at a maximal level and it takes a long time for your heart rate to come back down, that indicates that you're in poor fitness level. So that's a really good measurement of how fit you are. I'm not saying everybody has to kill it and get on a bike and race and all that. You don't need to be fit. And maybe even walking is going to be great for you. I really think, though, that a little bit of high-intensity training for short intervals or Tabatas, 20 seconds hard, 10 seconds off, or even as little as 2 minutes can be a really good way to get your heart rate, resting heart rate down and increase your fitness level. But you certainly don't have to overtrain. Unless you're an elite athlete or a competitor, sometimes overtraining can really cause too much inflammation in your body. You can do the opposite of what you're trying to do, because that recovery phase or rest phase is as important as your exercise phase. I'm convinced about. So look at your heart rate patterns. Certainly look at it at night. It's very important what your heart rate's doing at night. And it seems to be you'll have more of these arrhythmias at night for some reason. So look at that. Get yourself a heart rate monitor if you want. And if you have any questions, don't hesitate to come in, and maybe if you're having some problems, we'll do an EKG. Sometimes I send people for a Holter monitor, which it's a device that you wear that shows your heart rate over a couple day periods. It may pick up things that you won't pick up one time when you're in a doctor's office getting an EKG or listening to your heart. So heart rate is very important. Heart rate variability is very important. So look at that. That's something that's easily monitored. Certainly if it's off, you need to come in and get some blood work. I love the Cleveland Heart Panel because it shows me about everything I need to know about you, including hormone, thyroid, adrenals, blood count. If you're anemic, your heart has to pump more, so you may have a high heart rate because you're anemic, low red blood cell count. So all these things are very important. So start monitoring that heart rate. If you have any questions, please come see us at Performance Medicine. It's great. Hope you have a great Memorial Day and lead to a good summer. Hopefully we're out of some of this COVID scare thing, and let's get fit, and let's think about having a great new year. I'll see you next week.